Hey everyone, Deaunte Damper here, and welcome to King County Conversations. My name is Deaunte Damper. I'm one of the guest hosts here today, and I'm happy to have this lady as a guest who needs no introduction towards community conversations, towards restoring the state. I'm very happy to work alongside of you, but today I get to interview you. Welcome, Malika Lamont.
Thank you, Deaunte. It's a pleasure to be here.
I am so happy to have you during Recovery Month because this is a lot of your life's work kind of stems from that. So for community folks who don't have a history of who Malika Lamont is, can you give us a little 411?
I would say that probably more of, yes, I want to help support people in their recovery journeys and also create policy change that no longer ostracize, so that we no longer ostracize people that are experiencing behavioral health, both mental health and substance use issues, and to work to really address the health disparities that people of color are experiencing and marginalized folks are experiencing. I have been, in my younger years, I was an adolescent counselor working in a therapeutic foster care program many moons ago. I have done family support work a lot through in crisis response work in the earlier part of my career, and working with youth and their families that were experiencing substance use issues and intersections with the criminal legal system. I worked with the children as their parents were in the first drug court in Washington State in Pierce County back in the late 90s, early 2000s. And I have been a syringe exchange coordinator. I have performed syringe exchange in the fixed and mobile urban rural milieu that we had in Thurston County.
And just for the record, right? I just want to just say this. Is syringe exchange you passing out drugs?
No.
Okay.
No. And we also ask folks to not deal within a 2,000-foot radius, so about 2 blocks. And people were always, respectful of that because they took ownership of the program and they knew that they needed the services. And so folks were respectful of it.
Did you get pushed back?
What, from the individuals?
For just doing syringe exchange?
Oh, yeah. Yeah. I've had my run-ins with law enforcement, people threatening to arrest me. And because we didn't always do it, we didn't have a building when I first started doing it. We were doing it outside all the time. Rain, snow, sleet, hail, back roads. So I have done that. I've also done policy advocacy work for quite a long time as well. I've worked with people that experience developmental disabilities and delays, helping to do personal planning for them, doing legislative advocacy on behalf of and with. And then, these past few years, since 2018, I've been with Purpose Dignity Action. I started as a project manager for the LEAD initiative in Burien, which was the first place that LEAD was launched in King County outside of Seattle. And then became the director of Vocal Washington probably about a year and a half later, right before COVID. And then later became the director of the Washington State Technical Support Team for the LEAD model. And we work with the Recovery Navigator programs, the Arrest and Jail Alternative programs, and LEAD proper programs across the state.
That's a lot. And I think that a lot of your work is very pivotal to community advocacy. And when we talk about the policies that have impacted us over the past couple of years, you've been on the front line of reminding community members of what has happened before and how we can move forward. When we talk about the war on drugs in our community, you really give a great backstory on what it looked like back then and then what we can do now. So I've always appreciated that of you.
Thank you.
Can you tell us more about some of the policy work that you've been working on, that you've worked on over the years?
Oh gosh. So
I mean, condensed.
okay. How many years are we going back?
Yeah.
Give me parameters. Anyway,
I think the best time to start is during 2020.
okay.
All
right. So during 2020, of course, everybody's life changed. We all went into, the COVID era, anyway, that some might say we're still in the midst of, and we are definitely still experiencing the repercussions of. But in 2020, we also had the uprising that was in response to the murder of George Floyd. And, there were direct relationships to the war on drugs and the policies associated with the war on drugs that contributed to his death. That they, stopped him for a counterfeit $20 bill, supposedly, and then justified his homicide by saying that, he had ingested a stimulant at some point, and of course, using all the narratives laden with stigma in order to excuse the oppression and murder that he experienced, that then, catalyzed a national and international movement. And during 2020, we also recognized that, nobody was responding to folks that were experiencing their behavioral health, the symptoms of their behavioral health diagnoses and needs in our community. And PDA called together everyone that worked within the agency and said, what would it look like if we were to create a response that would meet the needs of folks? And because nobody, like cops weren't getting out of their cars, people weren't, and it's because they were directed to. I'm not making any judgment statement about them, but like people were still experiencing help or needing help, and people in the neighborhood were calling us throughout Seattle. And so we stood up housing. We said, what would it look like? How would we develop a harm reduction based model? And so I would say that is, that definitely impacted the policy reaction at that time. And then we also, personally, I am the co-founder of a low barrier buprenorphine clinic in my community. And we made a organizational policy decision that we were not going to stop services. And so we moved everything outside in order to be able to help people keep access to the medication assisted treatment that they needed, because they weren't able to go anywhere else to engage in healthcare. And then in 2021, we also saw during our legislative session, that's actually when you and I met.
Yes.
We
glorious
saw
times.
glorious times. We saw that legislatures were choosing to want to make different policy. And then we also saw that, and so we did a pathway to recovery. We had put forth a bill with Lauren Davis and a number of other organizations across the state that would move towards decriminalization and would create a pathway to recovery and treatment for everybody in our state, and that would create infrastructure across the state. That bill died, and then literally days later, the Washington State Supreme Court made the Blake decision, which overturned the simple possession statute in our state because it found it to be unconstitutional. And that was, again, where you and I joined forces in order to make sure that folks across all of our communities knew the implications of this bill and or of this finding.
Yes.
And then there was a lot of activity in the legislature to put forth a bill that would just recriminalize it at the felony level. And then we saw that there was a rejuvenation with the pathway to recovery piece that we had put forward earlier. And there were pieces of that bill being drawn into whatever was going to happen into the future. And, we all know the story. It went to a misdemeanor. At that point, we didn't make the decision to do full-on decrim. But one of the things that was really instrumental that was taken directly from the pathway to recovery was to build the capacity across the whole entire state for people, no matter where they were, to be able to access recovery supports in a way that they had never been able to before. The legislature, we advocated for them to make huge investments in housing. I mean, it was the single largest investment in housing that had ever been made in Washington State happened in 2021. Not to mention in the other ways that we could build support for people recognizing that recovery is not abstinence, but that it is, the reclaiming of one's life through meaningful connections, through access to healthcare, through access to resources, through access to education. And all of those different pieces were funded in that legislation in 2021. And the legislature has continued to invest in that, even though we have gone back to a gross misdemeanor and deepened the penalty for simple possession in our state and created the new crime of public use, as well as, sadly, moving back our progress on harm reduction 40 years. The thing that I will say the legislature has been consistent with is making investments into community and to build the network of supports and resources that people need. And the lead Washington State technical support team that I help direct, actually I do direct, but I help and that I work with. But it's the team. I want the team to get credit because they do amazing work. We're teaching the lead model, which is, wraparound supports, pre-booking diversion, and, making sure that people have the things that they need and the support that they need in their own community. And so we've been teaching that model, and they have continued to choose that as the policy direction, even in the midst of all these, other crimes that have been created or penalties that have been deepened. The legislature has also continued to invest in creating the supports for folks.
And that is good. And I think that, with all the work that you've been putting in, and community has been putting in, because what I love so much about your leadership is that everyone that walks alongside in your space of what you do, they are all leaders and they walk alongside with you in this effort. Do you feel that there's more that we could be able to do?
Oh, for sure. I mean, I think that, just one of the legacies, as we talked about the continued impacts of COVID, is that we lost a lot of infrastructure, services infrastructure. People's mental health really declined during that time. And we have not, me too. Anyway, we have not been able to create the amount of support that everyone needs. We have done a good job as far as like the state, has, like I said, made the financial investments to start, I would say, bringing us up to where we needed to be in 2019.
Yeah.
We're not anywhere close to where we need to be in 2024, 2025, and going forward. And a lot of the infrastructure and connection that has been generated in this time, it's useful, and it's also not nearly up to the scale of the need.
Yeah. And I think that, well, no, I'll interview you. So a lot of the work, you're the director of Vocal Washington. For people who aren't familiar, can you tell us a little bit about who Vocal is?
Yes.
And what we do?
Yes. So Vocal Washington stands for Voices of Community Activists and Leaders Washington, and we work with people that have been impacted by mass incarceration, the war on drugs, HIV and AIDS, and homelessness. And we really work to provide a home base as far as literally in the sense of if you looked at a baseball diamond, sometimes you need to just tap in and know that you've got a safe place, a foundation to be able to reach into. And we really try to create that space for the folks that participate in Vocal in whichever way they choose.
Yeah. And what are some of the things that Vocal has worked on? I feel so weird because, of course, I do work for Vocal, but I feel like y'all have to know what that looks like too. So, This is like the second time where I've had to interview Malika, and it's always just it's just different. Like we're talking in third party, but we're with each other. So go ahead.
That's okay. Vocal Washington, political advocacy is definitely something that we lean into, and we really work to collaborate with people that have been directly impacted by the issue areas that we focus on, and wherever they are in the continuum of, behavior change, where their life is, like stability, all of those things, we engage with folks and support them to bring their voices into those policy discussions. And we have a project that's called the Council of Expert Advisors on Drug Use that specifically is designed to do that development work with folks. We asked people that were in, like I said, all different stages of, where their substance use is, and said, what would be the ways that you would most want to engage? And folks told us that they would want to do brief surveys. And then, of course, we at CDU, in collaboration with our partners at Redo, would synthesize that data in order to report out. And then we also do focus groups in order to get the, more qualitative data. And so that is a really big piece of what we do. And also, you do a really great job of bringing in political candidates to speak with our participants, so that I feel like we also do a lot of civics learning opportunities to work with folks, to engage with them so that they understand the political processes that they're engaging in. We also do, like I said, the development work with folks to prepare them to go into policy space, because it can be kind of traumatic and it can be brutal anyway. And
they're talking about, they're having, I think one of the things that's interesting is like they have conversations about those folks, our folks.
Yes.
People that look like us.
Yes.
And it's like none of them have the lived experience. None of them live in the area. None of them
and
are a part of the solution or are part of the solution.
Yeah. I mean, and folks have really, frankly, cruel and brazen and almost disassociated conversations about people that are in, when that's occurring and you're in the room, that is really demoralizing and painful. And so we provide the after support for folks as well. And we pay people for bringing their expertise into that space. Yes. And we pay them at a rate that is comparable to what experts should be paid for bringing what they know into a policy space. So that's some of the work.
Yeah, some of the great work.
Some of the great work, yes.
Some of the great work. And, I know we talked a lot about, we talked about the policies that happen around the state, but how, I got a couple, this question is what I thought about on the way here. You live in Thurston County.
I do.
And what are some of the things that community can do? Because, we hear so much about King County. A little bit of Pierce. But what can we do to better support folks in King County that are impacted? Even though we know it's near the Capitol where they're making a lot of the decisions, I think that there could be more that community could do. You mean
supporting in Thurston County?
Yes.
Oh, you said King County. I just want to make sure.
Sorry, Thurston County.
Okay. Well, I think that really probably the most helpful thing or guidance that I could provide for folks to support people that may live in an area other than where you do is to enter with humility, number one. Do your research and ask people that live in the area what is happening and what are the issues that you are focused on. And let the people that live there take the lead. And then you come in beside them to do support. That's our model of supporting folks across the state. We come where we're invited. We have members all over the entire state. And if our membership wants help in a local event, then we will come and support them. and we will do it in a manner that they find to be helpful, not what we think is the thing to do. We'll share what we know and our perspective, but we don't come and jump over the people that are there. I think that oftentimes it's interesting to me. I see this phenomena with folks in King County. It's almost, okay, people don't get mad at me, but it feels like a little bit of a complacency, like that everything's going to stay great up here when we hear about more harmful things happening in other parts of the state.
Mm-hmm.
And the exact same things are happening here too, but it seems to not be able to permeate the echo chamber for some reason.
Mm-hmm.
So for example, in Lewis County, we've seen some really harmful policies that will have negative impacts on people that are trying to work towards their recovery. There is a syringe service program down there, as well as a treatment provider, that low barrier buprenorphine provider, and they're all housed together. But they have been going through a process at the county level, really driven by one of their county commissioners, to do things that are not evidence-based and that are really going to have a negative impact.
Mm-hmm.
So limiting the amount of syringe exchange that can happen in the rural areas where people are really isolated and don't have access to the equipment to keep themselves safe. And then also seeing that they have made rules that people have to be abstinent for a certain amount of time before they are able to volunteer, even though we know that having meaningful connection to activities is what helps people move along the cycle of behavior change and helps deepen recovery behaviors. And the abstinence is not anywhere on the SAMHSA recovery wheel. So, just things that don't make a lot of sense. But then exactly very similar things are happening in Kent, and nobody's paying attention to that. And Burien too. And seeing that, people are being marginalized in ways that a lot of people in King County, I think that they're immune to, but it's actually happening here. So I would say joining forces with each other is one of the things that, but listening to the folks that are local, and helping support them.
Absolutely. And, before we get out of here, what are some of the things that we can do to support LEAD? What are some of the things that we can do to support Vocal? What are some of the things that we can do to support you? All three questions need to be answered.
Okay. So some of the things that I think can be done to support LEAD or let everyone advance with dignity, also known as law enforcement assisted diversion, is for folks, because every county in Washington state theoretically should have a recovery navigator program. Find out who is providing those services in your community. Ask if you can be a part of the policy coordination group, the PCG. Find out what the people that are representing you in your area are doing as a part of those groups, so that your voice can be a part of what's occurring to help support folks in your area. For Vocal, please join us during our advocacy activities. And tune into our community conversations. And we're going to be helping support some candidate forums around the state. And so stay tuned on our Facebook page for those events. Come out and participate if you ever are in the area where we're going to be doing some things. At the end of the month, we will be in OMAC for their community recovery series of events that they're having.
Series of events
that are that I believe are happening on the 26th of September. And then but stay tuned on our Facebook. And then as for me, I would just ask that you consider the humanity of the people all around you, no matter how difficult it might be to feel care and love for that person. And I don't mean love I mean love in a justice sense. And justice as the pursuit of equity and as the pursuit of support and the pursuit of kindness amongst each other.
Absolutely. Well, thank you so much. And before we get out of here, I just have to say, because like we're in the space and we work together and all of the things, I met you 4 years ago and we were both going through the pandemic and we got navigated to each other, we'll say that. And ever since then, you have always been my North Star. And I did not know what it looked like to really sometimes hear myself to know that I could lead, because I've been around people that would just want me for just these one things. But what you've wanted from me, and it doesn't have nothing to do with like where we work. I'm talking about, you were talking about the individual within myself to go take care of myself. You will discover your recovery. And it wasn't you telling me to be clean. It was just telling you to have me take care of myself, learn how to take care of myself and trust my voice and not have imposter syndrome, but speaking to people in the state. I would not be in any of the positions that I am in, none of them, without your friendship, without your, without those late night calls, without those pouring into me. And I had to make sure that I said it here on the community conversations here, because I want this to be a time capsule of my love and admiration for you.
I love you too.
And very happy that all these other guests are coming on here. But you are a guest for everyone, but I'm just so happy that you are my sister and friend in heart.
Always and forever.
Yep. I cried and that sucks. Sorry, okay. Bro. Okay, y'all. Join us next time for our next community conversations. I am your guest host, Deaunte Damper. Until next week. See y'all later.